If you want to better understand what's going on with healthcare, Digital Health Review is the podcast that brings relevancy into the health technology conversation. Digital Health Review presents stories of health equity and technology, as well as actionable advice and news at the intersection of digital health, public health, and health equity. I'm Blair Hurst, your resident Black health tech nerd and host. Our guest today is Kim Hunt. In 2020, Kim was appointed to the Illinois Council of Aging by Governor J.B. Pritzker and was recently invited to join the AMA Foundation Fellowship Commission on LGBTQ health. She is currently the executive director of the Pride Action Tank, a multi-issue project incubator and think tank that is a project of AIDS Foundation Chicago, where she also serves as the senior director of policy and advocacy operations. Let's get started. It's been too long that public health servants have not been speaking with the tech builders and the business builders, and we need to bridge that gap.
Yeah, I can totally see why. And, that's part of why I do what I do, is trying to break down the silos between sectors and even within sectors. It's just amazing how, with all of these technological advances in terms of communicating and all the information that's out there, that folks still tend to stay in their bubbles, and structures continue to be created and recreated that really just hardwire the bubble instead of creating platforms where folks can come together around an issue or around a problem, and bring some amazing innovation and beauty and insights to addressing that issue.
Yeah. And the siloing, I think, sort of has left us where we are today. And some of the sectors of having either half solutions or just not enough concentrated effort to solve some barely basic solutions. Like you said, communication now has how many different avenues? We're not just talking about phone, we're talking about email and text messages and Discord and podcasts and blogs. There's so many ways now that we're able to communicate. And there's so many public health issues that are surrounded around a lack of communication or poor communication.
Yeah, for sure. For sure. Even within sectors, sometimes in public health, folks, I should say we, since I'm in public health.
You're included, yeah.
Don't even talk to each other enough, to see what's happening and how things can connect. And I'm sure the same is true in other sectors as well.
Yeah. I'm curious, what got you into public health and policy work?
Well, I'll say I fell into the public health work. The policy work, that piece was really an outgrowth of my background in urban planning, which was focused on transportation planning in particular. And that is very, very, very policy driven. And that's the area that I focused on. When I was in my 40s, I decided to get a second master's degree in public policy, because that's the part of the urban planning that really intrigued me, is just the impact that policy could have on so many people. And so, even as a public policy person, focused a bit on community and economic development before moving basically into LGBTQ rights work from an intersectional lens. And that led to more policy work that eventually got me to public health. So, I mentioned Pride Action Tank, which is the initiative that I co-founded that happens to be under AIDS Foundation Chicago, very much a public health focused organization. But the reason Pride Action Tank became such a good fit at AFC, and I'll back up and say, I've described Pride Action Tank as a project incubator and think tank on LGBTQ issues. Um, and our focus areas are aging, financial security, health, housing, youth, and something else, safety. And those are all social determinants of health, right? So when we were in discussions with AIDS Foundation Chicago, they had just finished their strategic planning that year. And this was 6 years ago, 6.5 years ago. And we're really leaning into more of the social determinants of health work that they'd already been doing, especially around housing, but other issues too. So it was a really nice fit with us. And then, since I've been at AFC, I've just really come to appreciate how important it is for folks to have good health or have access to the health care and health services that they need, that it's hard to imagine future for folks if their bodies and their mental health aren't taken care of. So after being a reluctant public health sector employee, I am now fully embracing this and really finding ways to bring this public health framework into all the work that I do as Pride Action Tank.
Yeah, there's so much there to unpack. Like,
Mm-hmm.
one of the things that, are you familiar with Maslow's hierarchy of needs?
Yes.
Exactly. So just the basic need to maintain one's health and safety, right, which is part of your mission there, supersedes all other things that someone can then go on to do to say that they're thriving.
Mm-hmm.
And one of the things that I'm most excited about in the digital health space is I'm starting to see people connecting the dots between SOTA, or social determinants of health, and existing or existing tech solutions, right? So a lot of them don't have to be directly related to health, and a lot of them aren't related to health. Housing is not necessarily something you would think about having to go to the doctor to figure out your housing, but housing is so closely related to your health. Transportation, you were in urban development. That's a huge, huge component, and not being able to get quality access to healthcare consistently, and disenfranchises a lot of folks if they don't have good transportation. And so thinking about that, thinking about, there's all these tech companies that are being built for digital health and for whatever they're interested in. How can we sort of redirect them and say, okay, if you're already going down a transportation route, add public health to that ticket as well, because it has a direct impact on it. Think about it in that way. And so I'm starting to see people make those connections, and I'm really excited to see where it goes. And I'm really excited to see those who are not just saying equity is part of their mission, but how they actually breed it into their products and how they're actually pushing it in their companies.
Yeah. Yeah, the digital space, is still a frontier for many folks in public health, and even as I think back on in my time in urban planning, when the connection between public health and planning was made, it was in the hard environment, in the physical space, right? How do you construct communities or plan communities in a way that encourages walking, in a way that minimizes automobiles and that kind of thing? Very physical, but not necessarily the digital pieces that could also be part of the urban environment. Even just having connectivity, right? We have seen during this pandemic is a huge issue, and that too is an urban planning. It's a health issue. It's all these things come together, and for me, what just gets re-emphasized over and over again, from when I was in urban planning to consulting to in public health now, everything is connected, right? Everything is connected. And if people cannot bring their full selves to the party, it's it, they miss out on things, and it's not their fault. It's things have been set up in such a way where everybody hasn't been considered. And I think the digital space is a way for everybody's needs to be considered, to become part of the framework and the design, for new ideas, and to help make old ideas better. There's just so much possibility in that. In seeing, entrepreneurs and public health people in the same digital space, because at the end of the day, we're people, right? And that's what I think gets lost in some of the big issues of the day, that we have to bring this down to the human level. um, it's taking the bite of the elephant one bite at a time, right? Which is a horrible analogy, but um,
Yeah,
uh, and that's where I think people get lost. They just see an intractable problem, and don't understand. You don't have to have all the answer. You create a space where all of these ideas and insights and thoughts can come together, and that's innovating, and that's building towards the world that I hope all of us want to see.
absolutely. I think those that are going to succeed are those that carry less about building it all themselves, but have
Mhm.
mastered the art of partnership.
Yep, I agree.
Yeah. So, taking a bite out of the elephant,
Mhm.
I'm curious for your work at AFC. What are the biggest health challenges going on right now for the LGBTQ plus and AIDS
Mhm.
communities? What do you see?
Yeah, so there's some biggies out there. Affordable healthcare is a big issue. Accessibility to good quality, affordable healthcare remains an issue. Cultural competency is huge. We know that there are biases in the healthcare space because there are people in the healthcare space. There are biases that say, for example, Black folks can handle more pain than white folks, so they don't need pain medications. There are biases that say, there are only two genders. So anyone who walks through uh, um, um, uh, healthcare space who does not conform to one of those two genders is not able to receive culturally competent services. So many things that we're trying to address at both the policy level, because, oh gosh, all it takes is a worldwide pandemic like um, COVID to show us how horrible our healthcare and safety net systems are. Um, so, there are things that we're trying to fix with public policy, and trying to maintain some of the changes that have been made to deal with the pandemic that have been life saving, like telehealth, for example, and have
Mm-hmm.
those be permanent. On the cultural competency front, this is a lot of, I spend a lot of time in this area, not just doing trainings, but also um, working with other organizations currently, even to develop uh, legislative actions that would require some of our government agencies to have culturally competent care, which is trainings, but trying to go deeper than trainings. So these are all issues that bar people from thriving. You mentioned that word earlier. Um, it's hard for folks to do much if their health care isn't there, isn't affordable, or isn't a space that they want to go back to because of the way they've been treated. So we're trying to deal with these issues and more, and have been for many years. It really is biting off one one chunk of the elephant at a time, and you have to know that that's what you're doing so that you can celebrate those victories when they
And
come.
pace yourself.
Yes.
And pace yourself. I
Don't
know
burn
that
yourself
was
out.
the key thing that I'm trying to do this year. Thing. So
Mhm.
I totally hear you on that. Who are you training? Is it healthcare providers? Like, who are you training?
I've done trainings for the insurance uh, folks who are making the determination of whether or not a person can receive gender affirming care, for example. In the legislation, we're looking at state funded service providers in the older LGBT of in the older adult space. I'll put it that way. Many of whom don't recognize that they have LGBTQ folks there, um, and LGBTQ folks who are of color, because sometimes you say those letters and people
Mm-hmm.
think of cisgender white gay men only, but there really is a rainbow under the rainbow. um, and yeah, so I've done training of other public health folks, as have other folks at AFC. So quite a few. And we just got legislation passed last session that requires 10 state agencies to collect sexual orientation and gender identity data. And that's going to need to come with some training as well.
That's amazing. That's amazing. As an aside, completely unrelated to our conversation, I, as you know, work with a lot of data, and I've run
Mhm.
through several questions and using demographic data to try and answer those questions.
Mhm.
And SOTA has always been a gap, as
Yeah.
well as gender expression and identity
Yep.
and orientation. So
Mhm.
SOGI. All of our
Mhm.
acronyms starts with S, it seems like. And having that policy, right, going back to the policy, having that policy in place requiring folks to think about it, organize
Mhm.
around it, and collect
Mhm.
it so that we can make informed decisions.
Mhm.
uh, that is the bread and butter, right?
It really is.
And it's just the basic ask, the basic
Yeah.
ask.
Yeah. Because we, for example, have no idea of the impact of COVID on LGBTQ folks because the data isn't collected. It's not collected at a national level. It's collected at a handful of states, and we have been fortunate to consult with many of the advocates who worked on those policies. They are few and far between. So data is so very important, as you know, to even know if we're moving the needle a little bit on any of these issues.
Yeah, it's critical. It's critical.
Hmm.
Where do you see the tech companies doing and creating impact with some of the challenges we were just talking about?
Yeah, I think, helping to capture the data is one piece, but getting back to affordability and accessibility of healthcare, I think there are definitely some tech interventions that could be helpful. And again, it's hard to know what all the possibilities are if you don't bring all the folks in the room, right? And we saw it happen at the Design-a-thon, but there are other spaces where just talking about an issue in a different way and having questions come from someone who doesn't necessarily work in that space often makes things better in general, even before you get to the tech, right? Just the posing the questions. But at the end of the day, there are definitely interventions that require a tech presence. We look at home testing for COVID, for example. We've been in and moving the home testing for um, HIV and AIDS. There's definitely we need to capture that data in some way. I have taken many home COVID tests myself That data doesn't go anywhere right now.
I know.
And it should. So yeah, lots of opportunities there to bring tech and public health together. And I hope that we can create some of those platforms, but they need to be sort of hard baked into how we think about solutions and how we don't have to do it in a silo, and how we can bring folks from so many different sectors together to address these issues is something that should be top of mind in public health and other spaces.
Yeah, I couldn't agree with you more. And that is exactly what I'm striving towards, is having those conversations in nuanced light, right? Because as you said, it's not until you actually ask the question, until you ask, from your perspective, from your career trajectory, from your lens, what happens when this happens? What happens if this happens? And that nuanced perspective allows for so many more solutions to come about,
Right.
or improvement of existing solutions, like you said, right? Makes the old ones better. Because I'm also a fan of not reinventing the wheel. If it ain't broke, don't fix it. That is absolutely true. Home COVID tests. What would that look like distributed for HIV/AIDS testing?
Yep.
What would that look like for cervical testing?
Exactly.
For Black women?
Yes.
The applications are multifold. And we know what the infrastructure problems are now that we've gone through COVID. This is a call to action for all the entrepreneurs out there who are thinking about what to do next. Solve that issue, I think. But yeah, I find the possibilities endless as well. There's something in the entrepreneur ecosystem around social innovation, social entrepreneurship that I think, public health is actually the umbrella to all of it, whether you're talking about solar panels or affordable, sustainable, high fashion, whatever it is, there's a public health component tied to it. And I think people should think about that first.
Absolutely. And I have been an entrepreneur and bring that mindset into my work now. And one thing that I love about just the entrepreneurial spirit is that everything can be tackled. You might not know the answer quite yet, but it's not seen as impossible. So I love that about entrepreneurs and about being an entrepreneur, is that you just keep going, right? Until you figure it out.
Yeah. My mama will call that the strength of a mustard seed.
Yes.
Yeah.
Thank you for joining us. If you'd like to subscribe to our newsletter, shop the latest digital health products, or listen to more episodes, please go to www.digitalhealthreview.com.